My name is Sister Mary Kilgariff. I'm a member of the Sisters of Mercy, formerly of the Burlingame region, now of the West Midwest community. But the community that I joined was the community that founded St. Mary's Medical Center back in 1857. And the history of St. Mary's really kind of is entwined with the history of San Francisco. Founded in 1857 by the Sisters of Mercy, who arrived actually 2 years prior to that date in 1854 at the request of Archbishop Alemany, San Francisco's very first archbishop. And Archbishop Alemany arrived in San Francisco shortly after the discovery of gold. And that prompted San Francisco to become a very unruly city for those who had come from worldwide, by land and by sea, to seek instant riches. Gold, as you know, was founded up in the Sierra Madre Mountains in 1848. And so approximately 50,000 people a month after the discovery of gold came into San Francisco and used it as a stopover city so that they could regroup and make it up to the Sierra Madre Mountains where they could find their instant riches. Those who did not find instant riches came back to San Francisco, and that added to the upheaval of the city. There was actually a body of leaders in San Francisco, a board of directors, if you will, but really the law and order of San Francisco at that time was primarily in the hands of various vigilante groups. And so when the sisters arrived in 1854, they were not met with a great amount of enthusiasm. In fact, the leader of one of the vigilante groups actually tried to run them out of the city. But in any case, Archbishop Alemany asked the sisters if they would simply visit the patients in the State Marine Hospital, which would have been considered San Francisco's first county hospital. And so they purchased a little cottage across the street from that hospital on Stockton Street at Broadway. And they continued to make their daily rounds across the street to visit the patients, to be with them in their dying process. Now, there were physicians in San Francisco, there were outstanding physicians in San Francisco. However, the primary care of patients was done in people's homes. About the time of the discovery of gold, there was about 35,000 people living in San Francisco. And as you know, San Francisco is a peninsula surrounded by water on all three sides. And the terrain was pretty much pockmarked by various farms, dairy farms, cattle farms, herbal farms, yerba buena, the good herb. And so when gold was discovered, with all the people coming into San Francisco, there was tremendous upheaval. And although there was one hospital, any doctor of good reputation would not admit a patient to the Marine State Hospital. You went there to die. Soon after the sisters began making rounds and visiting the patients, they began to also see what changes needed to be made. They had great experience from their time in Ireland. At the time that the order was founded by Catherine Macaulay in 1831, Ireland was just coming out of the effects of the penal code imposed on them by the British government. And so there was much destitution in Ireland, and especially in the city of Dublin, where young people, young men and women, would flock to the cities to see if they could get any type of a job. And Catherine Macaulay, the founders of the Sisters of Mercy, was actually born into an aristocratic family, and she was left a rather handsome inheritance by her relatives. And she used that money to go to the wealthiest part of Dublin and to put up a building, the first Sister of Mercy house, which was for the protection, the shelter, the education and training of young women, so many of whom were abandoned on the streets of Ireland. So the sisters had great experience in working in times of devastation, and that's what they met when they came to San Francisco. Soon after they began to make changes in the care, the quality of care that was provided to these dying patients, doctors began to rally around. And within 2 years of their arrival, receiving no monetary reimbursement from the city or the state, the sisters were able to garner enough funds to purchase the hospital. The city of San Francisco was in the process of building a new county hospital. And so they basically walked away from this original Marine State Hospital, and the sisters purchased it and put up the very first sign, St. Mary's Hospital, on July 27th, 1857. There were a number of doctors in the city who continued to make up the staff of that hospital. Dr. Beverly Cole, who was on that very first staff of the original St. Mary's, went on to found the University of California College of Medicine and the American Medical Association. Dr. Levi Cooper Lane, another physician on staff, went off to found the Stanford School of Medicine. Throughout the years, St. Mary's has been blessed by a number of outstanding physicians, and to this day we continue to see the medical practices that are provided through St. Mary's by these wonderful young physicians now. The hospital on Stockton at Broadway continued to function for the next 5 years. And then when the needs of the city outgrew the size of that hospital, there was land purchased at the base of what is now the Bay Bridge at First and Bryant. And so in 1861, the second St. Mary's Hospital opened its doors, and it was touted as the state-of-the-art hospital. It had an elevator lift, it had private rooms for $15 a week, it had double rooms for maybe $12 a week. If you brought your own orderly or aide, the price was knocked down further, and if you brought your own liquor, the price was knocked down even further. Many patients came to that St. Mary's Hospital, and in fact, in keeping with tradition of the Sisters of Mercy, the hospital had a ward for homeless men, elderly men. It had a ward for homeless elderly women, and it continued to have housing and shelter for young women where they could again be trained, educated, so that they could go off on their own and earn a livelihood. Catherine Macaulay felt that the greatest work that a religious order could do would be the education of young women, because once a young woman is educated, then she will go off and raise her family and be able to contribute mightily to society. And so that has always been a thread that has followed through all of the works, even our healthcare works. The St. Mary's Hospital, which the second one, which began in 1861, then functioned until 1906. And we all know what happened in 1906. The big earthquake struck San Francisco. And as with much of the city that was destroyed, St. Mary's Hospital was destroyed. However, not a single patient or staff member died as a result of the earthquake. The patients were taken by lift down to the ferry boat and then brought over to Providence Hospital in Oakland. And that hospital had started just a short time prior to the 1906 earthquake. So the patients were brought over there for shelter and safety. After the earthquake, San Francisco had many what were called tent cities. You had a tent city for lost and found, you had a tent city for food and shelter, you had tent cities for health care and emergency care. And the sisters, along with the soldiers in the Presidio, for the second time, were asked to man the emergency care right across the street from St. Mary's Hospital, where we are located now in Golden Gate Park. At the time of the earthquake, there was one building that housed the students, the medical students for the University of California College of Medicine. And those students would come down the hill to Golden Gate Park and practice their medicine on a daily basis. After a period of time, the third St. Mary's Hospital, actually in 1911, the third St. Mary's Hospital opened up on Hayes Street right at Stanyan. Now, the interesting thing about the third hospital being built in San Francisco, 1 year prior to the earthquake in 1905, the sisters had purchased the land at the corner of Stanyan and Hayes, where we are today. And the reason they did that was because they knew that with industry changing and the part of San Francisco that St. Mary's was located in, the primary arena would be that of industry. And so it was not a place for a hospital to be where they were located. So they moved off of that land, and we were shaken off of that land. And the original purchase was out at the area where Point Lobos is located. And that land was purchased in 1904. And shortly before beginning the building, the sisters, along with the physicians, it was highly recommended that they not move the third St. Mary's Hospital to that site, because there would be nothing out there but fog and water with the Pacific Ocean. And so then it was in 1905 that the sisters purchased the land that we're on today. In 1911, they opened up the third St. Mary's Hospital, with the entrance being on Hayes Street. Now, I want to bring you back just a little bit of history before that. It was in the Bryant Street, 2nd and Bryant Street Hospital, that St. Mary's began a school of nursing. And it was probably the first school of nursing in California, because when the sisters applied to the state for nursing accreditation standards, there were none. Those standards were not forthcoming until the early 1930s. And so the sisters went on to write what they would use as standards for their school of nursing. And the School of Nursing continued to function at St. Mary's until 1957, 58, when the school moved up to the University of San Francisco, where it is now a 4-year baccalaureate program. And it's my understanding that the University of San Francisco School of Nursing is the largest school up at USF, and it has just begun its doctoral program as well. St. Mary's, over the years, has been the recipient of many, many nurses that were trained not only at St. Mary's but at USF. And I believe that says a lot about the quality of care that we have been providing. When the third St. Mary's Hospital opened up, it functioned until about 1976, when the current tower that we are in now was put up, and we moved into that tower in I believe it was like August or September of 1976. Through those early years, St. Mary's had many firsts. When you are the first hospital in San Francisco, and perhaps even in California, you are the first in many things. So it was during the early years where St. Mary's was the first to be granted tumor board privileges for the study of cancer. We were the first hospital in California to do the total hip by Dr. Richard Welch, and the second in the United States. We were the second hospital in the United States to open up an AIDS dementia unit, which functioned for many, many years here at St. Mary's. We were the first hospital to do, in terms of current research, the invention or the intervention of pain, spinal pain, with the surgical procedure using the X-stop implant. St. Mary's, back in the 1950s, was the first hospital in San Francisco to begin an inpatient adolescent and pediatric mental health program. And that program has functioned throughout the years. We still have it today. However, because of policy changes in healthcare, and specifically those relating to the mental health care of adolescents and pediatrics, Macaulay Behavioral Science now consists of an inpatient adolescent program. For the past 27, 29 years, we've been working with the Unified School District of San Francisco, where the students who are unable to participate in the classroom setting, the normal classroom setting, come to St. Mary's, Macaulay Behavioral Science, where they receive care for their mental health needs, and also the curriculum continues for them with their regular academic school year. There is a graduation that takes place for high school seniors here at St. Mary's, and it's a wonderful experience, and we've been doing this now for about 27, 28 years. Back in the 1960s, when the state of California made the Hill-Burton funds available to hospitals that were 40 years old or older, Sister Mary Joanne DeVincenzi, who is still with us today at the hospital, was the administrator. And she appealed to the state for those funds and was granted the funds to build St. Mary's. And one of the very first things she did was to bring on a team of specialists. who could guide the planning and construction of the new St. Mary's Tower while she continued to be the administrator for the health care at the hospital. She had asked that this particular team send a letter out to as many of the former patients as possible to identify, in terms of constructing a hospital, what is it that they would like to see if they were to become a patient at St. Mary's once again. And the overwhelming majority of the responses that came in indicated that patients would like to have their private space, their private room. And that is how the hospital was built. It was opened in 1975, and in terms of the beauty of the hospital, it fits in right with the hilly terrain of San Francisco. The north side of the hospital overlooks the Golden Gate Bridge and the bay, and the south side of the hospital overlooks the University of California, the University of San Francisco, and again over Golden Gate Park to the Pacific Ocean, with the east side of the building looking over onto the downtown district and beyond the Oakland Hills. When we transferred the patients from the old hospital into the new hospital, we literally transferred them in their beds. We took the beds out of the room in the original hospital and brought them into the tower. Each patient was absolutely thrilled when they got into their own room. They had their own view, their own bathroom and shower facilities. They each had a television, and they could really manage their environment as they wished to manage it. Over the years, many patients have come to St. Mary's simply because of having their own special room, and their families have loved it just as well. And this comes into play beautifully when we understand the various cultures that make up San Francisco, that patients and their family and their culture can come into the private room and be with the patient and add a sense of even greater comfort for the patient. And so as hospitals scurry around now in the attempt to be retrofitted for earthquake upgrades, many are trying to design their hospitals and their upgrades and see if they can bring about private rooms. So the fourth St. Mary's Hospital was really the state of the art, opening up in 1975 with private rooms. It was after that time, and during that time to the present, that again St. Mary's continued many of the firsts. St. Mary's was the first hospital where the balloon angiography was performed. We were the first hospital where the implant of the X-stop for the relief of back pain. This device was designed by Dr. Ken Shu and Dr. Jim Zuckerman. And these two young doctors did their orthopedic residency here at St. Mary's many years prior to this intervention. The issue of obesity, which devastates people's lives, individuals and families, now can be treated through specific types of surgery. And St. Mary's was the first hospital in San Francisco to receive certification from Medicare as a center of excellence for the treatment of obesity. You know, the quality of kindness that is present in our mission statement, in our vision statement, in our core values, really relates to the dignity with which we see each patient and with which we see each other here at St. Mary's. Catherine Macaulay, when she started the Sisters of Mercy back in 1831, had really one rule for her community, and that was the rule of charity. And it was only through charity and kindness that enabled them to see the need and to meet the need. And so as this charism has been passed down through each one of us, the sisters and the staff and all of our partners in our mission of healthcare, it is that quality of kindness that guides how we treat our patients and how we treat each other.